Welcome back, viewers. You're still here on Scope with me, Waqar Rizvi. In this segment, we're going to discuss the leader of the WHO, Dr. Tedros Adhanom Ghebreyesus, who's made a statement recently saying that he's received death threats and racist insults while, of course, running the global efforts to fight the coronavirus pandemic. In part, he says, some of that has come from Taiwan, but I would imagine that a lot of those threats possibly would have increased ever since Donald Trump also went after him. And I actually want to, before getting to our guests, I actually want to play a video soundbite of Dr. Tedros speaking about those threats, because I think it's best to hear them from himself.
I can tell you personal attacks that has been going on for more than 2-3 months. Abuses, or racist comments, giving me names, black or Negro. I'm proud of being black or proud of being Negro, because that Negro is black, black is black, and I'm proud. I don't care, to be honest. And thank you for asking that question. Maybe for the first time I would make this public. Even death threat, I don't give a damn, because it's personally targeted to me. 3 months in the same situation.
All right, those are powerful words there. If we understand the context of who the head of the WHO currently is, he's an Ethiopian microbiologist, so he is, by any definition, a qualified man for this position. Secondly, he is the first African also to hold that position, and that is also a significant fact to keep in mind at this point in time. Well, let's now introduce our guests who are joining us for this segment. We're joined by Babina Kandola, who is an author. He specializes in how biases affect decision-making and behavior in organizations. His recent book is entitled Racism at Work, The Danger of Indifference. He's joining us now from Oxford in the UK. Joining us from the Italian capital, Rome, is Lyal Sunga, who is a visiting professor at the Raoul Wallenberg Institute of Human Rights and Humanitarian Law. Let's now go firstly to you, Bina. What do you make of Dr. Tedros's comments? It does come off as disturbing, doesn't it? Because this is in a context where we know ever since the coronavirus pandemic has begun, there have been racist attacks against Asians across the world, really. And then there was even those statements by French scientists about how vaccines should be tested in Africa.
I think your observations are actually very good, actually. There seems to have been an increase. We're doing some research now in the United Kingdom, looking at the increase in racism as it's experienced by the British-born Chinese community. And it's clearly demonstrated in our data that there has been an increase in racism. And that is fueled in part, I think, by political leaders making references to this being a Chinese disease. Donald Trump obviously being the person I'm talking about here. And having a minority in the UK, in the West's context, actually having somebody who's in a minority in a leadership position is unusual. And consequently, what our research has found is that where you find people from a minority, I'm talking from a UK context here, in leadership roles, they are undermined. And people find all sorts of ways of undermining them. Some very overt, as the leader of the WHO has found, and some of it can be quite subtle as well.
Lyal, what are your thoughts about? Because, you know, obviously, as the head of the WHO, as anybody who is in a leadership position, there may very well be legitimate criticism, right, of Dr. Tedros and his track record so far. But why does that then need to include his race, et cetera, do you think?
Well, you're absolutely right that, you know, nobody's leadership is beyond criticism, and no institution should be beyond criticism. It's through criticism that, you know, we can always do better, and that's true for all of us. But that's a very different thing from racist attacks or ad hominem attacks that he has been receiving. I wanted to underline another point, which is that, first of all, a couple of points. One is that you know, the Dr. Tedros Ghebreyesus, I commend him for coming out with the statement and exposing the kind of nonsense that he's been subjected to. So that's very important. And also Professor Candola's research and monitoring of this in the UK, this kind of instances that we're seeing from individuals all around the world. And you can do an easy search and you find that it's everywhere in the world. Even, mainland Chinese were first discriminating against people from Hubei, and Hubei people first, before that, from people from Wuhan, and then Hong Kongers against mainlanders, and then you find it in Europe and different countries. But there is a quantum leap between individual instances, and racism is always latent, and it comes out in these kind of fear-driven situations. Compare that with a head of state of United States, an important country, obviously, the world's remaining superpower, spreading this kind of association, calling it the Chinese virus. So that is very, very irresponsible on the part of President Trump.
Indeed. Bina, how does this racism, how do these sort of death threats then hurt the work that needs to be done, right? Because at this point in time, as Dr. Tedros has also said, listen, can we just get past this politicization of this issue and just work together at this point in time?
It can make it difficult. I mean, I thought his statement was there was obviously a lot of emotion there, and he managed to, and it was also very measured. He was saying what he was distinguishing between was personal attacks and attacks against the work and attacks against a group of people, a nation, a continent. And the personal attacks, they have hurt him. I don't have any doubt about that at all. But what he's valiantly trying to do, I think, is distinguishing between his own personal hurt and the way that this then affects the work that he is trying to do and the World Health Organization is trying to do. And he said this has been going on for 3 months. I mean, that's a long time to stay silent about these things. And there are risks about him speaking up about this too. For him, I mean.
Indeed. Indeed. So, Lyal, what are your thoughts about that? Because, in a leadership position, when you're trying to, for good or bad, whether you're doing a good job or not, you're nevertheless trying to manage this worldwide pandemic, which, again, even a person in his position would not have foreseen this coming, right? I mean, he, at least on paper, seemingly did send out warning signals the moment his organization realized this was something that countries around the world needed to deal with. In that context, this makes his job that much harder, right? Because we're adding in a whole other factor into this, which isn't really helping anybody.
Well, I wouldn't worry too much about Dr. Tedros Ghebreyesus. He's very, very experienced, and he's a solid guy who I don't think will be too much hurt. I mean, you're absolutely right that, of course, it doesn't help him at all. However, I very much like his statement because what he went on from the personal attacks, which he rightly underlined, and I'm sorry, it's a shame that these things have happened. But he then went on to underline individual and social responsibility to make sure that we all take care of our neighbors and each other, and regardless of race, religion, background, et cetera, et cetera. So I think the bigger worry is one that he underlined very, very well, which is about social responsibility. And he said that the virus, it creeps in where society is, the national unity is undermined, and that there's fissures across ideological, political divides. And so I think it's a very important message, and I was quite pleased to see that. And perhaps we'll have a moment to also debate that, the virus has had an astonishing effect on more vulnerable parts of the population, those that are suffering from poverty and weaker access to health, and who are not taken as seriously when they go to a doctor, and those are often visible minorities. And we see this laboratory experiment, unfortunately, in Sanjay Gupta from CNN was mentioning about Michigan and Illinois, where you have 1/3, 13% of the population is African American. That there are 31% of the cases, or 14% in Michigan, and 41% of the COVID deaths. Yeah. So there are vulnerabilities there that we also have to take account of, because it's a human problem, and trying to say that it's, and there's a lot of misinformation, disinformation out there, rumors that it only affects certain people and not others, etc. That is also does a great disservice.
Indeed. Bina, one of the that came out as I was reading more and more about this story is that it seems that for a lot of countries, actually, I would say from pretty much every country around the world, as I put in my introduction as well, no one foresees this level of a pandemic, right? So, I mean, you certainly want to have as many emergency measures which you can snap into place, but no one's fully ever prepared for this sort of scenario. So everyone was sort of caught off guard, and everyone's trying to do in their respective context the best that they can do. But there is, in this sense, do you not think that WHO or any other international organization would become an easy scapegoat for leaders such as Donald Trump at this point? Be they using that sort of racist language or just putting blame on somebody else for their own failures in this regard?
Yeah, and I think that finding scapegoats is groups being scapegoated has always been a way of people being racist, actually blaming somebody for their own misfortunes. It's finding an easy target. In the research that we've been doing, doing now, actually, that some people of Chinese heritage are saying that they are being blamed and scapegoated for this virus affecting the United Kingdom. It's clearly ridiculous. But we like to have a target. We like to have somebody to blame for things like this. As Professor Sunga said about the WHO, it can be criticized as an organization. The head of the WHO can be criticized as the leader. It's where it kind of, it's being used, what Dr. Tedros is saying is about direct, overt attacks on him. But sometimes the criticism of him could be founded in racist beliefs, and it's just being expressed in indirect ways. And that's very difficult then to untangle. And that's a very clever way of being racist, actually.
Indeed. Lyal, let's talk then about, very generally, if we can, about the African angle on all of this, right? Because we had those French scientists who have, by the way, denied that and have said that their conversation was possibly taken out of context. They didn't mean to have those vaccines tested in Africa. Whether we believe their words or not now in their defense of what they had said on TV at that point in time or not, nevertheless, that's what was perceived by many of us around the world, that what they were saying was that this vaccine should be tested on Africans. And then we have, as you alluded to as well, Lyal, the fact that within the United States, it's African Americans who are by far and disproportionately being affected by COVID-19. In fact, they're the ones who are the highest cases, and even actually the death rate is higher amongst that group. What do you make of that? Because that seems to be a huge factor, which I think a lot of us are ignoring around the world.
Well, I don't know about the French scientists or what may have been said or thought to have been said there. But getting to the underlying structural inequalities that you find, for example, in the United States, it's a good example where there is disparate access to healthcare. That's why you're seeing a very pronounced higher per capita rate of COVID deaths. That are grossly overrepresented than the percentage of the population. Another worry is that any country with weak healthcare systems, or maybe in developing countries or developed countries as well, that do not have universal healthcare. Us in the human rights field have been saying for decades, and it's the big message, human rights are a universal concern. And this just really emphasizes that, one person's one person's difficulties can affect everyone. And this is a very, very dramatic example of that. So I'm worried very much about persons that are part of vulnerable groups, and also in countries where they don't report any COVID, but their testing is close to zero, or the healthcare system is very, very weak. So we're all in this together, and it's going to come back and bite us very hard. All these things. So universal healthcare and a greater equality, and these structural inequalities are very, very well demonstrated in stark relief by this virus. And I think these are concerns, and looking at things from a human rights point of view would help a lot. Not spreading racism and rumors and disinformation and misinformation.
No, very well said. Bina, I wonder what your thoughts are on that. We've had a couple of politicians, haven't we, around the world saying that this is the great equalizer. This is the great leveler, I believe, is one of the British politicians that said. But then we've had this BBC Newsnight presenter who, you may have watched that segment, her intro, where she spoke about the fact that, sure, this virus does affect everybody, but then the resulting care that respective minorities versus the elite may be provided is quite different. And that's the case, be it in the UK or be it in the US or really any other country around the world. So that, again, goes to show the inequalities within our respective societies globally. How important is that factor to highlight?
Oh, it's really important to highlight. I don't think people are necessarily receptive to that message at the moment, because everybody is feeling threatened by the virus in every part of the world. But it is something that needs to be said, as Professor Sunga was saying, but also it needs to be reiterated once we're past this crisis and when the analysis and the reporting of what actually happened is carried out, that this will need to be an essential part of it, that some people, and that because of inequality that exists within society, some people were impacted probably, it looks like that will be the case, more than others. And we do need to talk about these things.
Indeed. So, Bina, let me stick with you, because just within the UK itself, we also have this new immigration plan coming into place, right? And we know that a lot of the what are called low-skilled workers, which is, again, that term I don't like to use, but that's the one that is used more often, that they will be under threat, really, under this new immigration system, even though, in fact, it's been proven that it is these quote-unquote low-skilled workers who are actually proving to be the ones who are very vital to keep society going at this time. They're the ones who bring us our groceries, et cetera, right, at this point in time, as we sit at home in the luxury, quote unquote, of our respective lockdowns. What do you make of that and how that will be dealt with? Do you think that the governments will be revisiting such policies?
They will have to revisit them in any case, I think, because I think there'll have to be some flexibility in the system. And I believe that before the virus, I seem to remember the Home Secretary saying that it'll be dependent on need. The immigration policy will be dependent on need of the nation at that moment in time. So I think there is some flexibility there, but without a doubt, some of the roles, some of the jobs that need to be carried out are not necessarily those jobs that people in the United Kingdom who were born and bred in the United Kingdom necessarily find attractive to do. So somebody will have to do them. So whilst we're talking about, and we do need to talk about and express gratitude to doctors and nurses and all the healthcare workers, we still need cleaners in hospital, the people who are keeping the hospitals clean enough for people to be attended to. They're not jobs that people typically are drawing attention to during this crisis, and we need people to do them.
Indeed. Lyal, I'll give you the final word. Do you think that there will be almost a reordering of a lot of the way that we look at the world around us in the aftermath of this coronavirus pandemic, when hopefully, we're looking at post-coronavirus? Do you think that we'll look at things differently, be it races or be it otherwise?
Well, I think that it's clear that this coronavirus is affecting, the economic situation very clearly, the political situation, and how people look at one another. And I don't know whether things are going to be in a more positive direction or a more negative direction in total, if we can say that. I think there's a lot of tendencies and push and pull factors each way. One of them, in terms of dangers, is the push towards nationalism and intolerance and right-wing politics. This is definitely giving a big push towards racism and xenophobia and racial discrimination of all sorts that we've seen. So that's really the downside. I hope that the more optimistic view would take hold, that people would recognize that we're, as I say, all in this together, and that human rights have to be bolstered. Otherwise, we all suffer. And I hope we're going to go in that direction. And I'd like to see a reordering towards much fuller promotion and protection of human rights, including the right to health in all its guises.
Yeah. Okay, fingers crossed. Of course, let me thank both Lyal and Bina for their time today and for giving us their expert insight on this topic. It's disturbing, isn't it, when you have this sort of a leader of this important organization, which is trying to at least seemingly help the world get past this coronavirus pandemic and deal with it within each nation's specific capacity. That doesn't mean that, of course, Dr. Tedros should not be criticized where it's legitimate, or the WHO. But why then bring in his race, or why then even, give him death threats? Is that called for in this sort of context? Maybe it's just about, as we spoke with our guests, about scapegoating him and the organization for each respective countries, especially those in the developing world, and their failures in being able to deal with this pandemic within their own borders. And so, this sort of talk is completely uncalled for. These sort of threats are completely uncalled for in any context, really, but especially in this context. And it's quite brave of him to come out and say so. Again, that does not mean that there is not legitimate criticism of him to be had, but it just doesn't need to do with the fact that he is the first African to lead the WHO. That may very well be making many people around the world quite uncomfortable. I'll leave it there for now. I've been Waqar Rizvi. Thanks for watching.